Hey TYT, this is Nomi Const. We're in Washington, D.C. Actually, we're in Senator Bernie Sanders' office, his conference room. The privilege of being here just after Senator Bernie Sanders put forward a piece of legislation for Medicare for all. There are now 17 co-sponsors, Democratic co-sponsors, in the Senate, when only 2 years ago today there were none. When 1 month ago today there was only one, along with Senator Sanders, and it was quite a presentation. You saw a mix of doctors and nurses and activists and folks who've had horrible situations occur due to our current medical system. Of course, that is the Affordable Care Act, Obamacare. And, there's a lot of things that need to be fixed. Senator Sanders introduced a doctor from Canada, one of the countries that is privileged to have a much better system than we do. And it is Dr. Danielle Martin, who is the author of Better Now, on the Canadian bestseller list. And there's a nice foreword, an endorsement by Senator Bernie Sanders. So thank you, Dr. Martin, for joining us.
Thanks for having me.
Bernie Sanders is endorsing your book. How did that happen?
So I'm a family doctor and a hospital administrator in Toronto, Canada. And in 2014, I was invited to come to the United States Senate to present before a Senate subcommittee about single-payer health care and how it works in Canada. And at that time, Senator Sanders was the chair of the subcommittee. So I was very excited to have the opportunity to come to Washington and talk about the Canadian system, how it works, and what we think that other countries, including the U.S., can learn from the way that we structure our system. And Senator Sanders was there, and I had a bit of an interchange with Senator Richard Burr about the healthcare system that got a little bit heated. And the video of that interchange went viral on the internet. I think it's been viewed 30 million times now.
Why are doctors exiting the public system in Canada?
Thank you for your question, Senator. If I didn't express myself in a way that make myself understood, I apologize. There are no doctors exiting the public system in Canada, and in fact, we see a net influx of physicians from the United States into the Canadian system over the last number of years. That was how I came to know Senator Sanders. And so when the Medicare for All bill came to be introduced, I think they wanted that Canadian perspective. And that's why I was invited back to be here today, which was really felt like a historic moment. I hope for the sake of Americans that people will look back on this day and say that was where it all began.
During the Democratic primary, there were challenges from the center left, the majority of the left, the establishment, that, okay, this is a socialized system. We're not a socialist country, and we're not Scandinavia, and it's not going to work. Things that happen in Scandinavia cannot happen in America. We're a much bigger country. Our economy is more complicated. I'm curious why they used Canada as a model versus some of the Scandinavian countries, or frankly, most of the countries in this world.
Right. So, first of all, it is the case that the United States is the only country in the developed world that doesn't have universal health coverage. And so there are many countries to choose from in thinking about how you would want to model a system in the U.S. that covers everyone and views healthcare as a right as opposed to a privilege. But I think one of the reasons why Canada is an interesting model for the U.S., first of all, is proximity. And I think most Americans know that Canada actually is not that different from the United States. We're, your closest neighbor, closest trading partner, lots of ways in which Canadians and Americans work together on all kinds of fronts. But the second is that actually we don't have socialized medicine in Canada, something that I think gets misrepresented in the American media a lot. There are a lot of myths about the Canadian system that get propagated in mainstream U.S. media. I'm a physician in the Canadian healthcare system. I don't work for the government. The government doesn't own my practice. The government doesn't tell me what to do. The government doesn't tell my patients what to do. They don't tell me as a patient who my doctor is. I have free choice of use of hospitals, any hospital I want to go to, any doctor I want to see. They're all covered. But the difference is that it's paid for through a public insurance plan as opposed to a private insurance plan. And in that sense, it does look a lot like American Medicare. And I think American Medicare is a program that is highly stable, has a lot of support across the country. I think people understand that it's not a socialized system, and it doesn't just work in socialist countries. Medicare works right here for everyone over the age of 65 and people with disabilities. And so what this bill is that was proposed by Senator Sanders today is simply to take a highly successful American program and make it available to everybody. In fact, if this bill passes, the United States will surpass Canada in terms of what's covered, because in Canada, we have free universal access to physician and hospital care. But this bill would also cover dental, it would cover pharmaceuticals, it would cover hearing aids, it would cover mental health and addictions, a lot of things that actually in Canada we're currently working to try to get included in our public plans.
The other opponents to this type of plan, they will often say, well, it's too expensive. We can't do this. Canada's a very large country in size, geographic terms. But, I do see the similarities between Canada, the type of economy that you have in Canada. You're in oil, oil is a major trading. There's a lot of similarities between our country and your country, other than just being neighbors. But the economic issue is a huge issue in the United States on both sides of the aisle. How would you explain to us that this is actually a better economic decision?
So, in fact, the United States in its current model has the most expensive healthcare system in the world. So you're paying way more, actually, than other countries pay per capita. So just as an example, the U.S. currently spends $10,000, approximately $10,000 U.S. per person every year on healthcare, and yet 28 million Americans have no insurance. In Canada, we spend under $5,000 US per capita per year, and we cover everybody. So I think there's a myth that covering everyone costs more. In fact, when you cover everyone through a single public plan, you can bargain much more effectively on your prices. You eliminate the huge profits that are made by private insurance companies and other kind of middle people along the way. And you make sure that the money that you're spending is actually going towards taking care of people rather than paying for, the advertising campaign of an insurance company that's trying to convince you to purchase their plan instead of somebody else's plan. So it's much more efficient, much more simple to have a single payer insurance plan. You don't have to fill out a bunch of paperwork every time you go to the doctor. You don't have to pay and then be reimbursed. You just present your health card in the Canadian system when you show up to the doctor's office or the hospital, and that's it. And it ends up actually costing much less and being a highly efficient way to run an insurance system.
And one of the arguments that we heard was that it's actually better for businesses because the burden is not put on businesses the way it is right now under Obamacare, which is a major complaint by small business owners, is that it's really cutting into their bottom line. I hate to ask you such simple questions in your mind, probably because you're an expert on this, but these are the things that our audience, that Americans are really wondering. All right, great. The healthcare system is cheaper once you go single payer. People don't have to go through the burdens that you had just mentioned. Obviously, they don't go broke. If they get in a car accident, they don't have to go bankrupt. But do they actually get the type of care that's needed? Are there long lines? Is it quality care? Are we talking about a socialized system that, we hear about people coming to the United States to get the best healthcare in the world? It might be Obamacare, but it is arguably the best healthcare in the world.
So I'm sorry to tell you that it's not the best healthcare in the world. I'm sorry. Every international comparison that has been done, actually, I'm sorry to say, the U.S. ranks at the bottom of industrialized countries. And there are a lot of reasons for that. Some of them have to do with the design of the healthcare system, some other reasons. But it actually consistently, Canada has health outcomes that are as good or better than the outcomes from the American system. We have a longer life expectancy than Americans. We have a lower infant mortality rate. We have fewer preventable deaths from all kinds of health problems, whether it's, heart disease, stroke, various forms of cancer, etc. So actually, the care in Canada is very good. It's very un-Canadian to boast like this, I have to say. Usually we're more apologetic, but we don't. But in fact, the data just don't bear out this assertion that American healthcare is the best in the world. Now, having said that, of course we have problems in the Canadian healthcare system. No system is perfect. Every country in the industrialized world is dealing now with an aging population, the rise of high technology, the advent of new, very expensive designer drugs, seemingly bottomless demand for services. We're all dealing with these issues. In Canada, you mentioned the wait list issue. I mean, we don't wait in Canada for urgent problems, but we do have issues around wait times for some non-urgent elective procedures and specialist appointments. And so we've got lots that we need to work on, and so does every country have challenges in its healthcare system, but we don't have 28 million people who would go bankrupt tomorrow if they got sick. And that, I think, I think it's important to bring the conversation about this Medicare for All Act back to that basic principle of, do we believe that access to healthcare is a human right? Mm-hmm. Do we believe that access to healthcare should be based on need or on ability to pay? And certainly the consensus in Canada absolutely overwhelmingly is, for all the problems that we have with our system, we would never trade it in for what you folks are dealing with here, ever. And so that's where we find ourselves. And insofar as what we experience can be useful or instructive to our neighbors as you figure out what you're going to do with your system, we would like to support making sure that our neighbors can all access the care that they need when they need it.
Well, you're showing your support. You were there today to tell your story to the entire world, but primarily to Capitol Hill today. And you have this book called Better Now, 6 Big Ideas to Improve Healthcare for All Canadians. But I'm sure we can learn from this.
I would hope so.
Where can we find this in America?
You can get it at any major bookstore, online, Amazon, Indigo, you name it.
Great. Dr. Danielle Martin, a pleasure. Thank you very much.
Thank you.